everyone, sitting out with Dr. Emer's office. We are doing, I believe it's treatment number 3, right?
This is my second laser treatment.
Second laser treatment, third Fractora for our patients. So we've been doing a combination of radio frequency microneedling with Fraxel. That way we are not only targeting the deepest layers of the skin, but also the surface layer of the skin. So we're getting more depth by adding the two together. And I've already done the Fractora portion of the treatment, but I want to show you is how your skin responds in different areas. Even though we're treating the face as a whole, as one section, as one zone, each subunit of the face has a different concern. So his forehead looks pretty good. It doesn't have the same type of rolling cobblestone type texture as the cheeks. And the nose doesn't have the same texture as the neck. So while I leave the energy the same and I target all of them, their response is a little different. So if you look here, I'm just gonna turn your head to the side. The forehead is still nice and smooth, just a little red. That's what you would expect from a typical Fractora treatment. When you kind of come over here, you can see that these are areas where he has some atrophic scarring, and with the energy treatment, they look a little bit more prominent, just a little bit red. They're warm to the touch, but all of this is going to settle down. We extend the treatment down to the neck where he has a few more scars, and all of this is going to improve with the radio frequency needling because you get a lot of tightening at the depth of the dermis. So you're going to get tightening in this skin here, tightening in this type of skin here, and also the shrinking of pores. It's safe for his skin type. You can see here, I focused on the areas that he had more scarring, and you can see this little row of swelling. So that's the type of response that you get. There's a little bit of perifollicular edema when I've treated over the hair. That's some swelling that's around the hair follicles, but that's the kind of response that you would expect. So we're going to move over now to Fraxel. So start up on the forehead. And the way that Fraxel works, I'm gonna give you some cold air. The way that Fraxel works is lace the surface skin, but also sends the energy into that middle depth of the dermis. So you get cell turnover. And when you allow your skin to shed the either thickened or thinned cells, you get a more even appearance in the skin tone. So what we do is we just evenly distribute this laser energy over our treatment area, and you can see, turn your head slightly, you may be able to see little white dots as the roller makes contact with the skin. Each little point on the roller is delivering energy. We just go back and forth, we lay down a few passes, and that's how we get the desired result. So this feels a little bit hot and scratchy. The radio frequency microneedling feels like a little pinprick with a contraction. We do use topical numbing for each of these. And we're gonna build up a little bit of heat in the skin as we continue. Doing okay? Mm-hmm. His results have been very good. Each time that we do this treatment, we get a little bit more improvement. Downtime is about a week, and then some redness that resolves thereafter. But always good, always worth continuing with. One more pass, and then I will go the other way. Are there any questions about doing combination treatments? While you look, I'll kind of talk a little bit about the aftercare. Because we're putting heat in the skin and because we are causing cell turnover, there are a few key things that we need to keep in mind when we're discussing aftercare. Go ahead and turn your head to the side. Perfect. So something that's going to be very important is the incorporation of things like growth factors, stem cells, cytokines, really using healing agents to our benefit. With Fraxel, if you have a little bit of downtime, it varies depending on what the patient's comfortable with. We can cater to their needs, but the growth factors really aid the process of healing and repairing the cell wall. We incorporate brighteners so that pigmentation risk is reduced, and good moisturizers and good hydrators that are also going to give the skin a nice drink of water, help make it look nice while the skin is healing a little bit. Sometimes with Fraxel you do get some of that.
Can you do this with active acne?
So you can do it with active acne. The Fractura treatment is phenomenal for active acne. It's indicated for cystic acne. So the way that it works is that when you send this radiofrequency heat deep in the skin, that heat shrinks down the oil glands, and less, you know, smaller oil glands means less oil means less acne. So when you do these treatments back to back in a series, and you're really penetrating into that deep layer where the oil glands are, you do shrink it. So about 5 to 8 treatments and your cystic acne is significantly improved. It's on average about 50% better. So it's a really good starting point. And then with Fraxel, you can choose the wavelength, whether it's a 19.7 that's more superficial, or a deeper, like for us right now, the 1550. You can use that to improve any scarring if there is any.
Can we, for post-treatment, is there any specific cleansers that you would have to use for this?
So we like 2 specific cleansers. There's a Resurfacing cleanser, which has the enzyme out of fish eggs, believe it or not, because this natural enzyme eats away at dead skin cells. It does not harm the skin surface. It doesn't compromise your natural skin barrier. Go ahead and turn. And then the other cleanser that we like comes in combination with, or it's used well in combination with, something called the Skinzyme Mask. And what that does is it uses enzymes as well to eat away at dead skin cells, improve on your downtime by cutting it down. And that cleanser potentiates the peel to just lift away anything that's kind of dry and flaking. Helps to remove some of these dots from the laser treatment. So we like those 2, but you want a gentle cleanser. After you've done a laser treatment like this, you don't need to be incorporating like a glycolic wash or an acne wash. You want to make sure that you're allowing your skin to rest where it needs to.
How long is the downtime?
Downtime typically with Fractura alone, I say is about 3-4 days. You are red and maybe a little puffy that day of, sort of warm in the skin. And then the day after, you just see these little needle pokes. They turn into baby little micro scabs that feel a little sandy on the skin. And then they flake away at about a week. For women or for men, you could use a little bit of a tinted sunscreen or some makeup and they pretty much disappear. With Fraxel, you're a little bit red and puffy for a little bit more time. The redness tends to persist for about 3 or 4 days. Could be a week, depending on how you set it. But typically about 3 to 4 days to 7 days.
How long can you do, or how long apart can you do Fraxel treatments?
So I would say that the best time frame for Fraxel treatments is about every 4 to 8 weeks, depending on the concern. You doing okay, hon?
Yeah.
Great. Move your chin a little bit. If we are looking to improve on the texture of like an acne scar, or like a surgical scar, for example, we may treat a little bit more frequently, about 4 months. When we are doing this full face treatment, it could be about every 6 weeks or 4 weeks. I like to do lasers within that 4 to 8 week time frame the most, because your skin sort of remembers what the goal is and you don't lose momentum with the treatment.
How does it feel?
How does this feel? I'll let you talk.
Like you said, a little prickly, a little feeling sensation all over.
A little hot and scratchy.
A little hot and scratchy, but nothing you can't, bear.
Bear for the result.
I'd just like to say I use the Restora C Pro and it's awesome.
The
face
cleanser.
wash. Right.
Do you use this? Have you used the Skinzyme mask?
I use that too, yes. Everything you guys give me, I use.
He's a good patient. All right, if there's no other questions, we're gonna just finish up here. Are there any other questions?
It just looks good. Perfect.
That's it?
Yep.
All right, cool. Well, thank you for letting us film, everyone. This was a combination of Fraxel with Fractura. We're on the Fraxel portion. We're almost done. You can see that the redness has continued to build up in the skin. There's very small little white specks right here. If you can see that next to the eye. He's gonna get skin tightening and resurfacing from this. And that is sort of the appearance that we're gonna have full face. And all those little white specks are gonna turn into little micro scabs, turn sandy and flake away in about a week. So that is our duo treatment for male acne scar improvement. Thanks everyone for watching.